what will these cuts mean for treatment and prevention programs around the world? Can they truly survive without U.S. contributions?
You know, the challenge is no. There's not enough money in the world to replace all of the infrastructure that the United States brought to the table. Even here in the United States, we're looking at over 130 million deaths because of these cuts eventually. So there's a real challenge, and we're going to have to convince our government to re-engage.
Is there a possibility that that can happen, that they're going to change course on this?
You know, this government, when they're pushed, they are renewing funding, but it's going to take a lot more advocacy and probably going to the courts to make sure they resume that funding.
What will these cuts mean for the countries in sub-Saharan Africa, the countries that really need this help the most and are most affected by AIDS, HIV?
We're already seeing tragedies and premature deaths in those countries in sub-Saharan Africa. And that's the problem. It's impacting just people are very, very sensitive to loss of therapeutics, the antiretroviral agents. And the other challenge we're going to have is the fact that when you start removing these drugs from people, they'll start not using the drugs properly, and we may even have drug resistance, HIV/AIDS in the future, and it may not take too long to get that.
Of course, there are also scientific setbacks, Dr. Benjamin. Many trials are now being suspended because of these cuts.
That's correct. They cut the National Institute of Health budget overall by over 40%. And it really was, in many ways, the economic engine for scientific innovation around the world. So again, it's important for civil society and other nations to step up as much as they can. But without the United States, we're in deep trouble.
I just want to get your reaction to what President Donald Trump had to say in making this decision. He said the cuts reflect a new emphasis on trade over charity in Africa.
You know, that's a terrible statement. This is humanitarian. This is just good health care. It's health diplomacy. It's not charity.
All right, Dr. Georges Benjamin, thank you.